Hi there, welcome back to Ask the Chiropractor, your source for ultimate health, healing, and chiropractic-related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan, and we're back with our co-host, Dr. Alex Rodnick, also out of Commerce Township, Michigan.
Glad to be here, Doc.
So we talked last episode about some things that happen in the winter, snow shoveling, slips and falls on the ice. We talked about car accidents, and we went into asthma. So we'll talk today, we'll continue right where we left off. We'll talk about some more things that we see a lot of times in the winter. A lot of colds and flus, especially winter time season, what they call the flu season. We'll talk a little bit about pneumonia, and we'll also talk today, we'll go right back into where we left off talking about asthma. So we'll talk, Doc, first, if you could just kind of give us a definition of what asthma is. Most people have no idea what it is, but they hear about it, and they see people sometimes with inhalers.
All right. Well, actually what it is the trachea and the bronchi. This is the tubing, essentially, that brings air from our mouth and nose down into our lungs and then back out again. And there's around the outside of it, there's these little muscles that help do this. And what happens is those muscles, they go into spasm and they contract, and that narrows the airway so we can't breathe out properly.
And so it constricts those bronchi or the bronchioles. They can't breathe in and out properly. Sometimes they can't breathe all the way out. So then a lot of times people start to have those asthmatic attacks, which can almost be a little panicking, almost like a panic attack, gasping in and out. And that's a lot of times when we need immediate attention, need the inhalers or the puffers to immediately send a gust of air, a lot of times medicated also, right through those bronchioles to open them up. And that's what the inhaler is. And most people don't know what it does. Well, they see it. There's a gust of air and puffs to open up those bronchioles. So let's talk a little bit about what we do as chiropractors that can affect asthma in adults and as well as children. We do see a lot of children in our office with not only asthma, with all sorts of different breathing problems that we're absolutely able to help with.
Well, oftentimes the reason why those bronchioles and the trachea are constricting is due to the nerve innervation is not working properly. Now, if you look down here, you can see that the nerves coming out of the upper back, these go down and they innervate the heart and lungs and the trachea and bronchi. And a lot of times what can happen, if those nerves are being irritated, they're going to fire off too much signal, and that's going to cause those muscles to constrict or spasm. And that's going to narrow that airway so the person won't be able to breathe properly.
And that's something that we see a lot. Here's an example of a kid that I've been seeing now for a couple of years. When he first came in, his mother and his grandmother brought him in, was like 3 years old, and he would have such bad problems sleeping at night because his breathing was so shallow, so noisy. They said he could barely sleep. When he did sleep, he would make all sorts of noises, almost sounded like snoring, but a little more severe. Snoring, gasping for air, just wasn't able to breathe very well. And he had been on nebulizers. He had been taking breathing treatments then for over a year. And so they brought him into our office, and all we did is we checked the spine. And not that we cure his breathing problems or cure his asthma. We don't cure anything like that at all. All we do is we remove some pressure from the nerve system, from the spine. And within just a few weeks, this young man was able to sleep through the night. His mom and his grandmother would tell me, you know, he doesn't breathe nearly as loud as he used to when he was trying to sleep. And they have to go check and make sure he's even still breathing because he was so quietly sleeping through the night. And we're actually working on publishing a study with this young man, and this was a couple of years ago. Now he's about 6 years old, and loves coming in, loves getting adjusted. Was really amazing testimony, amazing result. Was able to get off all his breathing treatments and get off the nebulizer, and is healthy as can be now. So it's amazing. This is the type of things that we love to do in our office, and the things that, the reason why we got into our profession, to help people and to help. We love to help children in our office.
It really is wonderful to see things like that. And like you were saying, with children, you usually see the results a lot sooner than somebody who's had this problem for 10, 20, 30, 40 years. Is in children that their bodies, heal
Absolutely.
A lot faster and respond
and
a
the
lot
body
faster.
also gets used to the things that it's been doing over years and years. So somebody's 40, 50 years old, they've had, bronchitis or asthma chronically for years and years. Their body is now used to having it. Their body is now used to the treatments that they do. Their body is used to having an inhaler. Their body is used to the medication that they're on. So it's a lot more difficult for us to make changes in that than it would be for a child who's, new to healing, new to their condition, and changes definitely occur a lot faster, like you said. So let's talk about how asthma or how chronic colds can become pneumonia and what pneumonia is. A lot of people hear that as a buzzword, and so we can kind of explain that to our studio audience, what that is. And
Okay, so pneumonia is essentially fluid in the lungs. And
pneumo means fluid.
right. And what happens is a lot of times, bronchitis, you have all this built up mucus, and you're coughing it up, you're trying to cough it up, and now when it gets worse and it gets down, the fluid gets down into your lungs, or the mucus starts to build up in your lungs, now you're unable to breathe properly because your lungs aren't able to expand all the way, and you're not able to get all the air in. I actually have a research study here, and it's adjustive manipulative treatment in elderly hospitalized patients with pneumonia. And this was just a pilot study here. And this was over 21 individuals with acute pneumonia, and they were in the hospital.
Acute meaning it's newer.
That
so
means
you
they
hear the difference between acute and chronic. Chronic means chronic means it's been going on for a long amount of time, where acute means it's still a newer or fresh condition.
Now, this wasn't the only treatment for the pneumonia. They were in the hospital. They were still getting antibiotics for the pneumonia. This was in addition to. They were getting adjustments during that time. And the one thing that really stood out above everything else was the average duration of antibiotic use that was needed, and it was very significant statistics. It went from an average in the study, or the non-treatment group or the control group, it was 3.1 days that those patients were under antibiotic treatments. And then the average for the patients who were being adjusted well under those same therapies, they only had an average of 0.8 days that they needed the antibiotics. So it's less than a third of the amount of time.
Difference. And not that they didn't need the antibiotics. And antibiotics are one of the only types of medication classifications that cure something. Antibiotics obviously kill off bacteria, and other type of classifications, pain relieving classifications, they don't cure anything. They just mask or cover up the pain. Where antibiotics, obviously, they do. They've saved a lot of people's lives because they kill off the bacteria. But unfortunately, though, with the antibiotics, they also kill off the good bacteria in the body too. There's bad bacteria, the type that we would see in pneumonia or in the lungs, and there's good bacteria, the type that we would see in our intestinal tract or some of the reproductive organs. And those bacteria are what the body needs and uses to actually sometimes help break down food. And so a lot of times without those bacteria, we start to have digestive issues, can't break down the food as well. We start to have bowel issues, constipation,
those are some of
diarrhea.
the biggest side effects of those antibiotics are the digestive issues, and also a lot of times we'll see yeast infections because the normal flora or the normal bacteria of the vaginal wall is not there.
Is then depleted also. And so limiting the amount and the use of the antibiotics by doing what they call alternative therapies, things like chiropractic care, where we can increase the immune system, and so they can limit it to less antibiotics than the average. That's significant. That's something that's really great to see. And so we can definitely be used in conjunction with the normal therapies that they had been using.
Right, and a lot of people, they want to either be, totally allopathic or totally holistic, and a lot of times the best way is a good combination. So,
Absolutely, absolutely. And
one more thing also, while we're talking about antibiotics, this is something that most people don't know, but a good way to prevent having those unwanted side effects is to help replenish your normal bacterial flora. And a good way to do that is to either supplement with probiotics, which are strains of these good bacteria that we want in our intestines and our mucous membranes. And also, a lot of times we'll see the same probiotics will be in yogurt. So by just adding yogurt into your diet or supplementing with a probiotic, will prevent those.
That's a great point. And so for our studio audience, this winter, if you're sick, if you have the pneumonia, if you have even different colds or flus and you end up on antibiotics, that's definitely some good things to do at home. Definitely want to replenish with the probiotics. You can get them at any health food store. You can get them online. A lot of times it'll be a powder, mix in water, the probiotics, and you just drink it down. Or again, the yogurts are excellent. The Greek yogurt, cheeses, a lot of dairy products will end up with those same bacteria in it. So by getting yogurt back into our diet right after we have been on antibiotics helps our body to replenish that a lot faster, will help the digestive system and the reproductive system.
And again, if you're doing this, don't take them at the same time, because then the antibiotics will actually kill off those probiotics right when you take them. So if you break it up, if you take the antibiotics in the morning, the probiotics at night, or however you do it.
Or after they had finished the round of antibiotics, then store back up on probiotics. Yeah, definitely don't want to have two things fighting each other at that point. So let's talk a little bit about colds in the winter. You know, they always say it's cold season or flu season, and I want to talk a little bit with our audience about, you know, that these things don't really come in seasons. Obviously, the bacteria, the viruses are around all the time. You know, there's different colds, different flus moving throughout the country, moving throughout the world, but it doesn't necessarily go in seasons. You know, they happen at different times every year. We see in our office sick people come in every day of the year. It doesn't matter if it's the winter, if it's the summer, if it's cold season, if it's flu season. We see sick people coming in all the time. And so with that, a good analogy that I like to use is that these things are around all the time. And I'm sure people notice that oftentimes, you know, you could be in a subway with people coughing and sneezing all over you, sick people all over the place, and for some reason, you don't get anything. And there could be another time that, you know, somebody sneezes in Cleveland, and you get it here in Detroit. And so a lot of it has to do with how well we keep our resistance up, how well we keep our immune system up. And so we want to go over with our audience some things we can do to keep our resistance up and keep our immune system up. Another analogy I like to use is flies with swamps, right? Every time you see a swamp, there's always bugs and flies buzzing around the swamp. Well, do the flies cause the mucky, murky water in the swamp? No, it's the opposite. And so with the mucky, murky water, flies are drawn to it and attracted to it. So do bacteria cause all people to get sick? No. If our immune system is a little weakened or resistance is a little down due to a lot of different things, we're now more of a good breeding ground, a good stomping ground where the flies or the bacteria want to congregate at.
Right. I mean, bacteria's job in the world essentially is to eat away dead and dying tissue, which, you know, is, you know, we're organic material, and that's what they eat. And so the best thing we can do is keep our bodies healthy, so that way these things aren't able to, they're opportunistic, essentially, which means that they wait for an opportunity where and then once that opportunity arises, then they thrive.
And if they have two people to go after, one has a strong immune system is doing all the right things, and one is a weakened immune system, obviously they're going to have a better chance to thrive with the weakened immune system. Mm-hmm. So some things that we can do at home, some things that keep our resistance up. Number one is rest, proper sleep. You know, if somebody's only sleeping 4 or 5 hours a day, their immune system is automatically going to be a little weaker. They're going to be much more susceptible to catching the cold.
Yeah, a lot of people don't realize, well, our bodies are constantly replacing themselves, but when we sleep, that's when we really get into the heart of it. That's when, you know, we shut off a lot of other functions. You know, we're not thinking, we're not, you know, using our muscles. We're just regenerating and healing up from all the damage we did throughout the previous day or week.
And so, you know, everybody's a little bit different, but between 7 and 9 hours is a great amount of sleep for most people. So we want to make sure, I know it's tough the holiday season to get the amount of rest, but that's definitely a big one to keep ourselves healthy and to keep our resistance up. Even if we have to take little naps throughout the day, naps are an excellent way to catch up on rest. We can get right into rapid eye movement or REM sleep, which is one of the best types of sleep for regeneration and healing, even if we take just a half an hour to an hour-long nap. We can get into REM sleep a few times throughout the day. Take a couple little naps throughout the day is excellent for the body to keep the immune system up. Another thing, obviously, that we can do is stay hydrated. When we drink a lot of water, we get what we need. The body is mostly made up of water. And so when we're dehydrated, the immune system is working a little slower, not quite as well. And so we want to make sure we stay hydrated during the holiday season.
A good analogy I like to use for how our immune system works with our white blood cells, it's kind of like having sharks in water. And if we become dehydrated, our mucous membranes dry out, well, it's like having a moat with sharks and there's no water. Well, when our pathways get dried out, those blood cells aren't able to move properly, and so they're not able to go and attack those pathogens.
It's a great analogy. And so definitely, you know, drinking 8 glasses of water a day, an excellent thing to keep our immune system up. Another thing is, is to avoid, it's hard during the holiday season, but to avoid a lot of the refined sugar. Refined sugar is something that will help weaken our immune system. So if we can avoid refined sugar and replace that with the natural sugar of fruits, you know, a lot of vitamin C and a lot of fruits, vitamin C and zinc are great vitamins to help support our immune system. So a lot of the citrusy type of fruits, oranges, grapefruits, any of these are going to be awesome to keep our immune system stronger in the holiday season. Again, zinc tablets are awesome to keep our immune system healthy too. People hear about the Zicam and those different types of zinc supplements, and zinc is definitely something that helps supplement the immune system.
Yeah, and a lot of times we don't get these things in our diet, so it is important to supplement, especially when if we're already more susceptible, if we're under stress, if we're not sleeping enough, you know, some of these different problems. If we can supplement, you know, add in extra vitamin C. I see those emergency packets all the time.
Yeah, a lot of people use those.
And just by adding extra vitamins into your diet, that'll really help give your body a fighting chance.
And can't hurt you. You can't really take too many of them, and if you do, your body you end up urinating it out.
Yeah.
So that's definitely something that's good to do. And again, avoiding some of those refined sugars. A big one is cola. So many people drink cola, carbonated beverages. Those are so terrible for not only our immune system, but for our bones and joints. Terrible for a lot in our health. So.
Well, another problem with those too is the caffeine in them. It actually dehydrates us. A lot of people don't understand how this works, but caffeine's an antidiuretic, which makes us, have to pee more. And by doing that, we're actually losing more water than we're gaining. So some people might say, "Oh no, I drink plenty," you know, but they drink plenty of
a
soda,
liter of Pepsi a day,
and they're not getting enough water, so they end up becoming dehydrated because of that.
And it also helps us, or prevents us from extracting normal vitamins and minerals from our food, because the carbonation that by drinking so much carbonation, it neutralizes the stomach acid, which, you know, sometimes could be a good thing. You eat too much food on a big Christmas meal, right? And you have a little bit of indigestion. A little cola can help that out. And at that time, it's a great thing. But when we're drinking cola every day on a daily basis, all that the carbonation in it will neutralize the stomach acid, and that will prevent us from absorbing and extracting some of the good nutrients that we were getting from our normal regular foods. So those are a few things that we can do to help prevent, catching some of the colds and flus this holiday season. And obviously the big one that we deal with a lot is keeping the vital and important nerve supply throughout the body. And that's what we do as chiropractors, and that's why we see that people under chiropractic care don't get sick nearly as often as people that aren't under chiropractic care. And why would that be, Doc?
Well, if you look at the way that the body works, your immune system, which is your body's self-defense mechanism, it's how your body fights off disease. It's actually controlled, like everything else, by your brain and spinal cord, by your nervous system. So if there's any interferences, any obstruction to the nerve pathways that are connecting our brain to our immune system, that's going to influence the way that it's going to function. It's going to decrease its ability to act, and it's going to decrease our ability to fight off these diseases. And then we end up getting sick because of it.
And so let's just show our audience what that looks like on a spinal model here. We see that the brain sits right here in the skull. You see that actually this brain stem area, it's only just a little bit exposed here near the medulla oblongata. See, most of the brain stem is tucked deep up inside the brain. Just this little part is exposed. And this is where it goes. The brain becomes the spinal cord. And it really shouldn't be called the spinal cord. It should be called the brain cord, because this is exactly what it is. It's the way that the brain communicates down and out to every cell, tissue, and organ in the body. And it's an amazing system we have here. Our immune system is fantastic. We have all sorts of different type of immune cells too. We have killer T cells that go after and they fight and they kill antigens. We also have memory cells that actually remember different things that they have seen before. And so when you have the memory cells properly programmed in the body to remember what it was like to see that bacteria that was in that cold or that flu, it remembers it, so next time it sees it, it goes right after
They're
it
like
again.
security cameras.
Exactly, and that's why they say once you get chickenpox once, you don't get it again, because the body then remembers exactly what it was like to have it. It's like security camera. It's really amazing that the way the different cells work with our immune system. And so by keeping as much nerve supply as possible, along with all the other things that we talked about today, we talked about getting proper rest, proper diet. We talked about making sure we're not dehydrated. So we have water in the moat for the sharks, which are part of the immune cells, the white blood cells. And definitely keeping vital nerve supply is one of the most important things that we can do. And again, like we said, people under chiropractic care definitely don't get sick nearly as often as people that are under. I want to switch over. We'll talk a little bit about another thing we see during the holiday season is sinus problems. We see a lot of people, and I see what people call in our office, like they say, the Michigan nose. Here's a testimony I had from a gentleman not that long ago that came in, didn't come in for a sinus problem, came in because he thought his posture was bad and he had a little bit of a stiff neck, right? So we started working on him, and within not even more than 2 weeks later, he came up to me and he said, "Doc, listen to this." And I didn't know what to think about that. I said, "Well, that's great." He said, "I haven't been able to do that for over 20 years. I haven't been able to take a full deep breath out of my nose. My sinus has been clogged for 20 years." He said he just always thought he had what he called the Michigan nose. Michigan nose, you live in Michigan with all the different changes in seasons, so he just was clogged up all the time there. And within just a couple of weeks, he saw some major differences. And so there's a lot of peer-reviewed studies about chiropractic with sinus problems, where they have less medications, they have less antibiotics, and just able to actually drain where others aren't. So this was a survey done with chiropractors in Australia that more than 50% of chiropractors stated that the asthma response to chiropractic adjustments, and more than 25% felt that chiropractic adjustments could benefit patients with dysmenorrhea, indigestion, constipation, migraine, and sinusitis. And these are just the people that saw them. And so this is definitely something we see a lot. So we encourage people that have a lot of sinus problems to let their friends and family know that they should definitely get a chiropractic consultation and checkup.
It's with sinusitis or any type of sinus infection. It's kind of like a river flowing, right? Our sinuses, they're tubes that we have fluid running through them, and if everything's running, it's nice and clean, just like a river. Now, if you put a dam up and the water gets blocked and it builds up, and then it begins to over time you start to grow things, kind of like we were saying earlier with you get the mosquitoes and the flies and all this stuff because the water is not moving. Now, if it was continuing to moving, you wouldn't have any of those problems. So we've got to get it so it's still going to flow properly.
Exactly.
Get everything free of obstruction.
And that's exactly one thing that we do as chiropractors. So that's one reason why we see so many people in our office with it and have such amazing results. So I want to talk. The last thing I want to bring up today, we just have a few minutes left. I want to talk about that in chiropractic offices, there's lots of different techniques, lots of different methods of practicing, but in our office, I like to say that we have 3 different types of patients. And in our office, we like to support people with whatever type of patient they would like to be. We have the type of patients that have a problem, and they come in for a few adjustments to start to feel better. Then we may not see them until the next time they have a problem. And these are the type of people, they come in a few times a year. They come in, they specifically have an ache or pain. We help them get over that, and then we don't see them again for months, years, whatever. And they come in when they have another thing, and then all of a sudden their sinuses are clogged, they have a cold, they want to help feel a little better then. Then we don't see them again 6 months later, a year later, now their back is bothering them. So we have that type of patient, and we absolutely support that. And then the second type of patient we have are people that we call, that do what we call corrective care. Corrective care is a little more often. That's when people are coming in 2, 3, 4 days a week to help stabilize the muscles and ligaments around the spine and make more structural changes rather than just functional changes. We're dealing with the consistency of the muscles and ligaments and the structure of the spine, again, rather than just getting them to feel better. And of course, if that's what people want to do in our office, we absolutely support that, and we see great results with that. And we see changes when we take an x-ray, then we have to take another x-ray later. We can see much more changes then than people that came in every once in a while. Then the third type of patients that we see in our office, they do what we call more of maintenance or wellness care. That's more like a retainer after braces come off the teeth. And most of these people had gone through a corrective care process first. Then they do what we call, like I said, the maintenance or wellness care. And these are most of the people that really understand how chiropractic affects their immune system, their overall health. These are most of the time people that come in, mom, dad, all the kids, the whole family is under chiropractic care, maybe even the grandparents also. And again, if people want to do this, in our office we support them with that. We want to know what people's goals are so that we can support them with whatever type of care that they would like. Now, there's lots of different methods of chiropractic, and there's some chiropractors that just do one specific part of those. And that's where a lot of misconceptions come from. Some people think if you see a chiropractor, they're going to tell you got to come in all the time. Or there's some people are going to say, well, I see the chiropractor and they never tell me when to come back. I just go in when I feel like it. And it's all different, depends on what their goals are. with what the structure of the spine. That's why it's so important for us to do so much patient education. That's why it's important for us to do the television show like we do. It's important for us to do patient education in our office so people know exactly how the spine works, how the body works, so they can make the most informed decision on what they want to do for their health and their whole family's health.
Mm-hmm. And with each of those different types of patients, we personally like to help each one of them to reach their health goals. Obviously, the ones who are just coming in when they're hurting, they end up really just scratching the surface, because if they don't follow through with the structural correction, then those same types of symptoms usually end up reoccurring, you know, maybe a month later or a year later or 10 years later, but they resurface. And
so we want them to understand what we can do, what their options are, but again, we want to support them with what their goals are. And if that's their goal, we absolutely support them with that. No question about it. So we just have a few minutes left, and I'd like to go over with you. I know you had a really great testimonial to share, a patient you had seen that had been in a motorcycle accident. You want to share that with us, Doc, before we wrap up today?
Yeah, this was, you hear about some of these miracle stories, and you know, and a day in, day out, we see unbelievable things. You know, people who have been suffering with, you know, severe headaches for years and years and years, and finally, all of a sudden, they're gone. And you know, that's amazing. But this one really you know, took me by surprise. This was a lady who had she had been coming into the office for maintenance care, and she had gotten in a bad motorcycle accident, and she fell and she cracked her helmet, and luckily she didn't fracture anything, which was a miracle. You know, falling off of a motorcycle while it's moving and, you know, landing on your neck and shoulder, it's not, you know, a very safe experience at all, you know. So there was a lot of damage. But one thing she had noticed was there was a loss of hearing in one of her ears, and she was unable to hear out of her ear. And she had, so after the accident, she came into us for a more intensive care plan than the regular maintenance that she was doing previously. And she was seeing a neurologist and an orthopedist, and you know, we were working together with her. And one day, this was probably about a week or two into her treatment plan, we just, one of the adjustments, we got it just enough pressure off, and all of a sudden she could hear out of her ear again. And she was, you know, she was all excited. She came running into the next room. I was already with the next patient, and she came over and she said, talking to my ear, I can hear out of my ear again. And it's really just a phenomenal, testimonial.
That's miraculous. That's a really amazing thing, and most importantly, made such an impact on her life and on her family's life that we love to see that. So that's all the time we have today for Ask the Chiropractor. Again, I'm Dr. Adam Rodnick out of Commerce Township. We were here with our co-host, Dr. Alex Rodnick, also out of Commerce Township. And remember that God gave us the gift of life, and what we do with that gift is our gift back to God. We'll see you next time on Ask the Chiropractor, and you have a fantastic holiday season.